is Dr. Masi Hashemian. In this section, I want to talk about crowns. When do we use a crown versus fill the tooth? Well, if your tooth structure is damaged by cavity, about maybe 1/3 of the tooth is gone, or it's damaged on the wrong place. For example, you have a cavity on the area that you're biting down on, then the pressure or the force of your bite is so much that might break the filling. In that case, your dentist might offer to get a crown instead of the filling to make sure that your tooth structure underneath stays strong. A crown or a cap is basically a full coverage, or it could be a partial coverage of your tooth structure, depending on how much of a damage you have. If it's a partial, it's called an onlay, or it could be an inlay. Or if it's a full coverage, it's a crown. It could be made from different material. It could be gold. It could be porcelain fused to metal. So inside would be looking like metal, outside white. Or it could be full porcelain, so metal free and full porcelain, which is what we do mainly in our office. So when we have to repair a tooth because of the cavity, the size of the cavity is excessive, or you might have an old filling and that old filling has been leaking for a while and you have more of a damage with recurrent cavity, it's too large for yet one more filling, then you end up getting a crown or a cap. In that case, the dentist has to prepare the tooth. So we remove the old filling, we remove the recurrent cavity, make sure everything is clean. Sometimes we have to build it back up with special material so it looks like a baby tooth. And then we get an impression, a mold of your tooth. Send it to the lab, or sometimes there are some machines that we can actually make it in the office, make the crown, and then the next session we deliver to the patient. The crowns are always cemented on, so if you have something sticky, sticky candy, you can actually take it off. So we want to make sure we give the instruction to our patients that even though you have a cap now, that your tooth is covered by the cap or the crown, it can come off if you have any sticky candy. So make sure you don't chew on the food that's sticky, beef jerky, things like that can loosen your crown. Also, you still need to maintain it, floss regularly, see your dentist regularly for your cleanings, because they can still get cavities. Sometimes people say, it's not my tooth, it's a crown. It is your tooth under a crown. So you still need to maintain it, maybe even more so, because it's hard to see if there's any problem under the crown through the x-ray. So you have to really be on top of it, take care of it, floss and brush, and let your dentist go around it, check it out. If there's any problems starting there, they can try to address it. If it's too late, then you have to replace the crown. So proper maintenance is very, very important. Okay, I hope I answered that question that sometimes we have in our office. When do we get a filling versus a crown for you? Hope to see you in the future videos we provide. Thank you. Bye-bye.